welcome to Vitals of Academia with New York Medical College's SpinGap chapter. I'm Angelique, one of the co-presidents of NRMC's SpinGap chapter, Building the Next Generation of Academic Physicians, which is a national organization that aims to help underrepresented groups become aware of academic medicine as a career option and to provide them with the resources to further explore and potentially embark on an academic medicine career. NYMC's chapter of BINGAP started in 2022, and Battles of Academia is a new podcast that aims to highlight the careers of academic physicians and demystify the process for how they built their careers. I have with me today Dr. Etienne, who is a board certified in neurology, epilepsy, clinical neurophysiology, brain injury medicine, and public health. Dr. Etienne is the founding director for the Comprehensive Epilepsy Center at Walter Reed National Military Medical Center. And while at Walter Reed, Dr. Etienne was the Associate Program Director of the Neurology Residency Program and was on the Clinical Neurophysiology teaching faculty for the National Institute of Neurological Disorders and Stroke at the NIH. He is captain of the U.S. Navy and currently serves as executive officer for the USNS Comfort Reserve Unit. At NYMC, Dr. Etienne is Associate Professor of Neurology and Medicine, where he is also Vice Chancellor at NYMC, and in addition, he is the Associate Dean for Student Affairs. Dr. Etienne is also Director for the Multiculturalism in Medicine, Impact of War on Medicine, and Health and Justice electives for fourth-year medical students. Dr. Etienne is a fellow for the American Academy of Neurology, American Neurological Association, and American Epilepsy Society. He has authored numerous book chapters and publications in peer-reviewed journals, and he is part of AOA, a National Honor Society, and has received multiple teaching awards throughout his tenure at NYMC, including the 2024 American Academy of Neurology DEI Changemaker Award and the 2024 American Medical Association Dedication to the Profession Award. So welcome, Dr. Etienne. So excited to have you here and just have to hear more about your story and kind of like how you got started and everything. So great to have you here.
Yeah, thanks so much for having me, Angelique. I appreciate it.
Awesome. So I guess just to kind of get started, can you tell us a little bit about your journey to becoming a physician and what led you to pursuing medicine?
Sure. So I first really, I think as I was growing up, I always had a interest in science. I was always drawn to science, and I think as I was transitioning from high school to medical school, it seemed like I guess not having a lot of knowledge about what's out there. Said, you can become a doctor, a lawyer, or an engineer. That was kind of the things that I that I was hearing about. And it seemed like when I started college at Yale, that was what a lot of the people around me were going into. So I did do a little bit of exploring. I worked with a judge at one point, and would go to the judge's chambers and observe cases, and I thought that was interesting. But the summer between my first and second year of college, I worked at Harlem Hospital, really for like about maybe 8 weeks or so, in the emergency room. And there, I could definitely see myself doing that. I connected with the doctors, physician's assistants who were in the ER, the nurses, the whole team, and got a really good sense of what doctors do. And really just said, yeah, this is what I want to do with my career.
That's awesome. Yeah, I didn't realize that you almost wanted to be a judge for a little bit and kind of like go the law.
Yeah, that's why, health, that's why I teach health and justice now. I still have the little bit of interest in law that I find that stuff pretty fascinating. But I think I much more enjoy taking care of patients, being there for people in some of their more difficult times.
Yeah, awesome. Yeah, definitely all the dots are connecting now, so that makes a lot of sense.
Yeah.
Awesome. And then what were the early years of your medical career look like, and how did you decide to transition into academic medicine?
Yeah, so after finishing as I went through my residency, I remember just seeing the large number of patients coming in with strokes, coming in with different neurological conditions, and really looked at it like, I was helping one patient at a time, and I really felt like, how can I affect more patients? What could I do to actually have a more broad impact on patient care? And especially since I was seeing a disproportionate amount of African American and Hispanics coming in with these strokes that were preventable. And that's what made me develop an interest in getting a public health degree. So I stayed at Columbia, did a fellowship, I did a triple fellowship, epilepsy, clinical neurophysiology, but also neuroepidemiology, which was done through the NIH, the National Institutes of Health. And that allowed me to get my master's in public health, and really get the training, to get a better understanding of how to actually impact healthcare on a more broad basis, doing population health. So after getting that training, I felt like I was on the right path to being able to have a broader impact. And then after my fellowship, I actually ended up doing a pivot and went on active duty in the U.S. Navy. And how that came about was that I did a little bit of research and noticed that the U.S. military did not have a comprehensive epilepsy center. And knowing that the signature wound of the wars in Iraq and Afghanistan was traumatic brain injury, I wanted to be a part of actually starting that. So I pitched it to the military and said I'd really like to start this program at the new Walter Reed because it was about to go through a merger to combine the Navy and Army hospitals. And so I was able to go down there and actually work with a really good colleague, Dr. Rebecca Fasano, to develop that center.
Oh, wow, that's awesome. Yeah, I really like how you say about like, academic medicine allowing you to like impact multiple patients was one of the things that I really like about being a physician in academic medicine. It's just, you have such a larger impact. But yeah, I didn't realize that's also what prompted you to kind of go to the military or go to the Navy was just like wanting to like help the patients that you saw were in need there, which I think is such a great way of kind of like making sure you're not only like noticing the need, but really like addressing it too. So that's really awesome.
Yeah, and the need wasn't completely there yet. I was kind of predicting the need, because there were lots of traumatic brain injuries, and I knew that traumatic brain injury leads to epilepsy. I said there's going to be a surge of people with seizures in the military, and said we need to be ready to actually receive those patients. But to backtrack a little bit, my senior year of medical school is when the 9/11 attacks happened, where the Twin Towers were attacked. And that was what initially sparked my interest in the military. I felt like I wanted to be a part of the people defending our nation as we had been under attack. And so I started the process, and during my residency, I ended up getting commissioned, and then later on, went on after finishing my training, went on active duty to do that work that I just described.
Awesome. And then I guess maybe if you just talk a little bit about like kind of like that process, because I know a lot of times you hear about like joining the Navy or the Army kind of like at the beginning of medical school, but not really as much towards the end. Was it hard kind of, I guess, making that transition of like applying and, doing that process throughout your residency and then like afterwards, or was it not as difficult as a transition?
I found it to be relative, not that complicated. I mean, only that the problem was that you don't have a lot of time as a resident to be filling out paperwork, and going for exams and doing all these kind of things. But the recruiters are pretty good in general for the U.S. military. They try to make it as easy as possible for you. I guess the one thing I missed out on was if I had done it in medical school, my medical school would have been free. So I missed out on that opportunity. But I joined later, and I think I actually like joining on my terms and joining mainly because this is what I felt. I joined at a time that I actually felt the calling for it, when I really felt compelled and that I had something that I can add to the nation's defense. So I think it is good to do things the way, based on what you think you can contribute, as opposed to just doing it for, kind of randomly, not knowing what you're doing.
Yeah. Yeah, that's true. Like making sure you actually have like the heart to do it when you do get called to do it. So that's awesome. And
Yeah.
then I know you mentioned kind of like reaching out and then like starting that program with Walter Reed. I guess were there any particular hurdles that was really hard? Because I could just imagine like you're starting something from scratch that there is no probably blueprint for, especially with the like armed forces. So how was that transitioning and starting it and kind of like what was your experience, doing it?
Yeah, the biggest piece is getting people to see your vision and to follow you to see that you're starting something brand new that people don't aren't clear as needed or as necessary. So you got to really convince the key stakeholders that this is something that's needed. Um, Fortunately, since this was through the U.S. government, there's a lot, there was funding available. We have the U.S. budget, so they can allocate those funds to support that. So that was very helpful. At other institutions, you'd have to really kind of probably try to find out where is this money going to come from. But we kind of knew where this money was coming from. The And then making sure you have the appropriate expertise. We had to train, techs, have the techs to support it, to do the, connecting EEGs, making sure that the nurses are properly trained, making sure the doctors are there to support it, creating a training program for the residents, right? Because now you're going to want to start teaching the residents this area. And when I first went on active duty, I was the only active duty epilepsy specialist in the US military. And now we've got numerous. And a lot of that has to do with the fact that we actually had this training, we had this program there that was able to get those residents' interest. And then from there, they all went on to do their fellowships and got the training. And that's one of the things I would say when we talk about, disadvantaged students, if you could think back to when I first started, I said, when I started with school, I had a few ideas in my head, doctor, lawyer, engineer. So a lot of times depending on your background, you might not have as much exposure to know what else is available to you. So likewise, with these residents, if they weren't getting exposed to epilepsy and EEG, they weren't going to go into that field. Now they got the exposure and they say, oh yeah, this is a really cool field. So now more people actually end up going into it. But for our young people out there, I say, keep a broad interest. Try to talk to different doctors, talk to different students or residents or whoever it is to really find out the full scope of what's available to you as you enter the field of medicine.
Yeah, that's definitely like a really great point because I think, yeah, there's so much in medicine. There's so many different things in medicine, so many different specialties that unless you are exposed to it, you probably don't even realize this is something that really will fit your interest or something that will be a good fit for you. So yeah, exposure I think is like a big is key and it's a big problem because a lot of times people don't have exposure, which is why sometimes those like early high school programs are so important so that way students kind of even see like is medicine a good fit for them or are there other medical careers like outside of being an MD that is like a good fit for them. So yeah.
Yeah, yeah. Those opportunities make a huge difference because they get to get an idea of what is it like to be a doctor and the different fields that are available, so that when you go for an interview, you sound a little bit more sophisticated. You've done your research, you know how to speak the lingo, as opposed to coming and saying, "Oh yeah, I want to just help patients." And then, what does that look like? I have not, you have no idea. So really going out there, volunteering, those who have made it, reaching back, what we call lift as you climb, bring those other young people up to get them that exposure. Very important.
Yeah. Let this you climb. I really like that. I'm going to start using that now. I'm going for it. It's awesome. And then I know just kind of going back a little bit, you just talking about like starting the program Walter Reed was kind of like getting people to see your vision. I guess because I feel like sometimes that might be really hard. So like what advice do you have to kind of like show people a vision that you have, even if it's just like an initiative student trying to start in campus and trying to get like faculty's buy-in or other students buy-in, like what would you suggest in kind of showing people, having people buy into a vision that you have and you're trying to like get more support for?
Yeah, I think probably the first thing would be to show them that there's an actual problem that you're trying to solve. If you just say, "Oh, I think we should have this program," it's like, okay, what's different about this program versus five other programs people want to start? But if you say, "Well, we've got a problem here with lots of people have traumatic brain injury, and we know a large number of them will develop seizures. We don't have a system in place to take care of these folks yet. And let's get ahead of the problem." And so once they can see it, and then you can get them to identify with it. They'll say, "Oh yeah, this is a real big problem. What can I do to help with this problem?" And then you can sell the idea and say that this is what we need to do. I'm ready to do it. Because one of the other things that we tend to see is there are a lot of people out there who will like to complain and say, oh my God, this is a problem, this is a problem, this is a problem, but they've got no solutions. And so it's like you just kind of used up a lot of airtime and breath to talk about this thing, and then there's no solution. And then you just leave a meeting, a 1 hour meeting, and nothing got done. Say, no, no, no. Here's the problem, and here is how we can actually fix it. And this is what your role can be in helping to solve that problem. And that's a little bit different. And so people will say, oh yeah, now I can get on board with that. It's not elusive. They can actually see the tangible impact that it actually has on these folks.
Mm. Yeah, that's a really great like approach for it, kind of like showing that not only there's a problem, but like here's the solution, and not just like pointing fingers at something that no one knows how to fix. So awesome. And then I guess just like in general for careers in academic medicine, are there any particular barriers that you feel like are hard for trainees to kind of overcome, or any barriers that you perceive for trainees for having a successful career in academic medicine?
Yeah, I think one of the barriers, probably one of the things probably that needs to be demystified is what is academic medicine? It can look in so many different ways. Are we talking about undergraduate medical education, which is what we refer to as what's happening at the medical school? Is it graduate medical education, working with residents, fellows, and other folks who have finished medical school already? Are you teaching basic science? Are you involved in research? Are you involved in some other level of this academic medicine? So there's a lot of different ways to get involved with the academic medicine. So the first thing is for the person to say, what are the options? It's just like, academic med saying I'm going to go into academic medicine is almost like saying you're going into medicine. It's like, okay, are you going to do medicine? Are you going to do neurology? Are you going to do surgery? Lots of options. Academic medicine is the exact same thing. And depending on what aspect of it you're interested in, there's different things you might want to be doing to get yourself primed up to move in that direction.
Yeah, that's definitely true. There's so many different aspects of it, and you could kind of like go back and forth too. You don't necessarily have to stick with just one. So, yeah, that's the point. Just like kind of knowing what it is the
Yeah,
biggest.
exactly. Yeah,
Yeah.
exactly. So when I started out in academic medicine in GME, which is I was associate program director at Walter Reed for the residency program. So that was mostly working with residents, but also medical students would rotate on the service. When I got to NYMC, my focus has been more on the UME, primarily working with medical students, getting them ready for the residency process, teaching various courses, mentoring students as they rotate through rotations, and then obviously my administrative roles at the school.
Mm, awesome. Cool. And I guess with that, what has been some of the factors that influence your decision to stay in academia versus pursuing private practice or like doing other things in medicine?
Yeah, so I'm probably what some people might call a privademic, which is that I'm working somewhat in private practice, although it's a hospital-owned practice, and working in academia at the same time. And which is another thing, like some people think you have to choose between the two. That either you go into private practice or you go into academic. No, you'd have to choose between the two. You can actually do both. There are ways to incorporate the two. I would say the longer I've been in academic medicine, the more I feel I need to be in academic medicine, because I'm learning a great deal. I'm seeing a lot of the challenges that our students are facing, and getting better ideas about how to actually address some of those challenges. And I think now, especially, there's been a lot of change in the country. So really helping students navigate those changes is going to be very important.
Yeah, definitely for sure. And I guess kind of just like to kind of piggyback off that question. I know like a lot, like you mentioned, has changed with like the current administration, especially when it comes to like DEI and health equity. And so, what advice would you have for any students who maybe have interested in health equity research or DEI initiatives and aren't really sure kind of how to, push pour into those interests going forward, or if they should even do it?
Yeah, this is a tricky area, because especially because there's a lot of funding that's tied to coming from different sources that may not necessarily fund this area. but I think it is important that to pursue your interests. And when we say DEI, we say, what are you talking about when you say DEI? This is a very wide range of things. Are you interested in health equity? Are you interested in, in enhancing diversity in certain fields? Are you focused more on trying to get people who are in a space to feel included, to feel that they're part of the team? Um, I think it's important for the students to pursue that. I think probably one thing they want to do as you're getting started on this path is to identify mentors who have experience in that space. You want people who have a record of accomplishment and who are doing it in a way that makes sense. I have seen some, there are some programs out there that, they might say they're DEI and I'm like looking at it, I'm like, whoa, what is that? I don't know what that is. What is your goal here? But I think one is to be clear on what is the DEI. I might even answer that. To me, when you talk about this area, we're talking about making sure that one, you're ensuring that the best possible candidates are getting selected for positions. So that's number one. So DEI, I know that some suggestion that it's getting unqualified people, but I would, from my standpoint, at least the way I've run my programs, it's making sure that the best qualified candidates are being put into the positions. Best qualified, uh, good, obviously also good. Sometimes we have to be careful about saying the word fit, a good fit, because sometimes fit can be used in, best fit can be a little bit interesting depending on how people are viewing fit. But I would say the most highly qualified candidates will get the positions if you have a really good DEI program in place. The Because oftentimes what happens is for various reasons, different life experiences that interviewers or application reviewers may have had, they may not recognize those highly qualified candidates because of the lens that they're using as they review these applications or as they review whatever documents they have before them. But that's probably the biggest driving point I would say is we want the best qualified people. We're getting people to become physicians. I want top flight physicians. I don't want a second rate or unqualified physician. I want the top qualified. And that's what I think DEI will actually bring is getting those highly qualified candidates interviewed and then ultimately accepted into schools and jobs, etc.
Yeah, awesome. Yeah, I really like how you like define it. Like it's all about like making sure the most qualified people are in those positions, not about bringing in unqualified people, but just making sure that the playing field is really leveled and just that making sure that like no one's bringing in their own viewing through their own like for lack of a better term bias lenses because no one thinks that their lenses are biased, but just making sure that like you're really looking at each applicant and bringing in the most qualified person. So. And I
Yeah,
also really like how you mentioned like finding mentors that are doing what you want to do in a way that makes sense. Because yeah, even following a mentor that doesn't align with what you believe in won't really be an effective mentor. So really kind of finding that I think was like a really great advice for students who are interested in pursuing something, um, if in like any type of like DEI space or health equity or anything along those lines. So awesome.
yeah, yeah. And then the other thing, absolutely. And the other thing I would say is what when we talk about this diversity and inclusion is sometimes it means there are some people with less opportunities. I don't use this word achievement gap that people like to throw around and say, oh, there's an achievement gap here. No, no, no. We're talking about opportunity gaps. So there are some people for various reasons in their background, oftentimes based on whether we're raised, certain demographic factors, etc., have less opportunities growing up. So it's a reasonable thing to help them get that pathway, get them on track to be able to get into those competitive colleges and getting into medical school later on. So again, I was fortunate when I was in high school and beginning of college. I was introduced to a somebody named Dr. Trowers at He was the head of the ER at Harlem Hospital. He would pick me up. I mean, I had no way to get to Harlem Hospital from where I lived. He would pick me up every morning. Sometimes at night, he did some night shifts, and he drove me down into the city. And I got to work in the ER and saw it firsthand. And that experience changed my overall trajectory. And I really had no other way to do that. So just something as simple as that put me on the path that I actually am on today. So I'm forever grateful for that. But then if I didn't have that opportunity, what would have happened? So sometimes we do have to say there's a lot of talented folks out there that we have to reach back and find out how to give them that exposure, how to give them that opportunity, so they actually have a fighting chance, and just being more aware, make them even aware of what they can actually do with their careers. So I highly encourage people to do pathway programs. I will share that, we have our a pathway program where we work with college grads who are from disadvantaged backgrounds, and we expose them to medicine at our school. And one of them just told me that she got into medical school. Said, yeah, it's just a little bit of exposure, a little bit of support. And I expect others to be getting into medical school from that program, a small program that we've piloted. And this is what these folks need. So now that school that student is going to was able to get access to that one of those top candidates that they might have missed out on if they didn't review that application or what have you.
Yeah, yeah, that's really awesome. That's so exciting to hear that, like, yeah, like you're seeing the fruit of it like in real time as the students are coming back and telling you they get accepted. So yeah, that's really awesome. Yeah, and I know even myself, like my mom, I think because she was a nurse, she ended up like bringing me to like a lot of like doctors to have them shadow me, and I like shadowed like OB-GYNs, which I did not go into OB-GYN. I am going to anesthesia, but it was like a great exposure, I think, to show me like what medicine and healthcare was, which ultimately had a big impact on me being here now. So those early exposures really do have a big impact on, your trajectory and like where you end up. So,
Yeah, yeah. And the other thing that it does is for these folks who are often marginalized, when somebody reaches back, it tells them that they matter,
mm,
that you matter, we care about you, we're going to try to give you the resources so you can succeed. And then you can see that the person kills it. Imagine not having that, you never know which person is that, going to be that Nobel laureate or that, get that top prize. And that's who you want. You want your best talent out there practicing medicine, entering those, particularly going back to underserved communities to give care to people who don't have access to care, make our country healthier.
mm. Yeah, definitely. Yeah, because then that kind of like changes the whole landscape for everything when you have people in those positions, and they're really kind of like able to talk about their experiences, how they got there, and bring a different lens to that perspective or to that position. So.
Yeah, absolutely.
And then I guess just to shift gears, like we're just kind of talking more about like mindset, and kind of like things that have been helpful for you. Are there any like skills or mindsets you wish that you developed earlier in your career, that you didn't get into later on that you have found to be really helpful?
I think I think one of the most important things is collaboration. I think I've always appreciated collaboration, but I think I've gotten a much higher level understanding of how important it is. That really, to get something done, collaboration is extremely important, and it's collaborating with people from different backgrounds, people with different mindsets, um, who will help you to fully understand the problem because they approach it differently. And that's one of the values of diversity. We have a working group that I lead, and I've made sure a working group that looks to, find ways to enhance belonging in our communities. And I've made sure, I think a lot of places, these kind of working groups tend to be predominantly, people of maybe similar mindsets who are all like kind of like what people might call, progressive, hard, far left people. But for a true inclusion, no, we need to have some of the more conservative mindsets as well. You want a broad spectrum of how people think, where they came from. It could be, we're talking about, it could be different racial backgrounds, different ethnic backgrounds, different religious backgrounds, different socioeconomic status, different political ideology, different parts of the country. You want all those things. Because when you have people from all these different backgrounds sitting in a room together, you can actually get so many perspectives and different ways of understanding the same problem. And you say, "Oh, I didn't think of this as that." Um, and then by hearing everybody and actually active listening, not just letting somebody talk, and as soon as they finish talking, you're already before they even finish, you're giving the opposite thing. And I'm like, wait, you didn't even hear what they just said. You just want to disagree. It's like, no, no, no. We want to listen to each other and get on the same page. So collaborating with different people and not being afraid to hear people who have a different way of thinking from you, I think is extremely important. And I picked a lot of that up from serving in the military because we work with people from all over the country. And we have to work together and we don't really get too caught up in, politics or all those kind of things because we have a mission, things we want to get done. And that works out really well.
Yeah, that's definitely a great perspective to have because yeah, like I think if you have a working group or a group that's just everyone has the same like homogenous ideas, like that's not really trying to like tackle the problem or it doesn't show you the perspective you want. So you're making sure it's really broad and expansive. Is like definitely the key. So I like the idea of collaboration that you mentioned and how you framed it. So awesome. And then I know you do so much between like school and like your private practice and the Navy, and you're also a father and have a whole family. So how do you manage everything like work-life balance, work balance? How do you kind of get everything done?
Yeah, so early on, one of the things I always did was like I would say bookends on my day, which was I dropped my kids off. Uh, I don't do that anymore, but for many years I did that. I would be the one to drop off to the bus or to the school, and I was also the one to do the pickup. And what that did is it kind of bookended my day, so that meant I couldn't start too early because of the fact that I had other obligations in the morning. And then by having being the one to pick them up from their after school program, that also put a hard stop of when I had to be out of work. So that was one of the strategies I used. I knew that if I didn't do that, the balance would not be there. So, so that's one of the big things I've done. I think keeping calendars, being careful about. I think early one of the thing advice I got years ago was early in your career, you want to say yes a lot, and then later in your career, you want to say no a lot. Because as you get more accomplished and people get to know the quality of your work, you get more and more invitations to do talks and to come do this and come do that. But you have to be selective and say, okay, I can't really do everything. Which of these are the priority? Which of these are going to have the impact that I'm looking to have to affect more students or more patients or whatever it is that the venue might be. And then you pick based on that, kind of like trying to stay true to your core values as you pick what you're doing.
Awesome. Yeah, I really like that. In the beginning, say yes a lot, and once you like actually have a lot more going on, say no and just make sure you stick to your core ground value. So I think that's like good advice to keep in mind for all of us who are trying to like build our careers and figure out how to get started. So awesome. And I think as one of our last few questions, will just be what advice or what do you hope to leave as your legacy in academic medicine, both for your students and for your specialty?
I would say for my students, the most important thing I would say is to really be a doctor to your patients and to each other. I think that something I hear too often from patients is that I'm the first doctor to listen to them. And although that's a compliment, it also, I find it also offensive for our field that this is how the patients view us. This is maybe not offensive, but it's like it's feedback. It's feedback for physicians to say our patients think that we're not listening. And maybe you are listening, but your patient doesn't think you're listening. So you're going to have to figure out, what do you do to get your patient to understand that you care about them? You're going to validate their experiences. You're going to make eye contact with them. You're not going to hide behind a screen when speaking to them. Really connecting with those patients. I think that's really one of the most important things that physicians can do for their patients, because if you don't connect with them, less likely they're going to actually trust you and follow your treatment plans. So, which means basically you're ineffective. You're not doing anything. You've got a head full of knowledge that you're not using because nobody's listening to you. So really take the time to connect with your patients. I know there's a stress of many hours or, time limits or whatever it is, but you got to connect with those patients, even if it's a 5 or 10 minute encounter. And I've done it. I've had short encounters where I quickly connect, and I like to spend more time getting to know the patient. Once you know the patient, they'll share so much with you. They'll tell you more. You'll be able to figure out what's wrong with them much, much, much better. So that's number one is, listening to your patients, and then listening to your colleagues as they go through their struggles. Being a physician is hard. Being a physician is tough. And, there's a lot of pressure on physicians. Physicians do have high suicide rates, much higher than the general population. They have high rates of what we call burnout, being stressed out. And so we have to be there for each other, to support each other and say, my colleague is in distress. Um, how can I help them? So they're not your patient, but you can still help them. And by helping them, you become a better doctor. So you can better help your patients. So that's an important thing. And it is something that could become a crisis in our field. It is a crisis already. But we really got to help each other out.
Right. Yeah, I really liked how you said that. Like, I think a lot of times we think about the patient. I think, but even like you mentioned, like helping your colleagues and being a doctor to your colleagues and supporting them in that way. So, yeah, I think that's a really great thing for us to keep in mind as we figure out like how to help um our colleagues and really like helping the whole field in general and how patients like perceive us. So awesome. But yeah, I guess wrapping up now to a close. Before we end, is there any last minute advice you would like to give any students in terms of how to go into academic medicine, things that you wish you knew, or just, any parting wisdom you would like to share?
Yeah, I would say one is it's great. Academic medicine is awesome. As I said a little bit earlier, that the more I'm in it, the more I feel like I need to stay here. Is you can be a role model to a lot of students. You can help them along on their journeys. You can help them navigate their journeys. And just like each patient is unique, every student that I mentor and teach, I find is unique. And I don't believe in a one size fits all advice to the student. We got to look at each individual student. What is it that you want out of your career? Then we can figure out what are your next step. But it is very fulfilling. The other thing I'll say is sometimes you might have a mentor that it's not working out. You know what? It's like a old car that's not working out. Get rid of it. Get a new one. Sometimes you can, and you don't have to be, it doesn't have to be, it's kind of like you can separation. Say, I've appreciated the many years you've given me, these 2 years, 3 years, whatever. And now we're gonna part ways. I had a patient the other day say to me, how do I break up with my doctor? Because they wanted to leave their other just to come to me. And I said, that's an interesting question. I kind of went over it with them. How to show respect to that doctor while you transition to a new one, but don't feel stuck with a mentor or advisor or whoever it is. I actually think it's good practice to have multiple mentors, because you might have three or four, because one of them might be really good at this area, but you need somebody else for something else. So having multiple mentors with different career paths, different approaches to solving problems can be very helpful and can enrich your career so you don't feel this is the only way to do it, because it's not. There are lots of ways to do it. And keeping that open mind and following, your own path. The mentors are there. Keep in mind, mentors are biased too. If you come to me and say, what field should I go into? If you don't say anything, I'm gonna say neurology. But if I get to know you, and I say, oh, maybe you might want to consider this other anesthesia, surgery, this, that, and the other. But mentors have their own biases when they're giving you advice. So keep that in mind and say, I know what lenses my mentor has as they're giving the advice, and be careful not to just go down the wrong path because you're doing what the mentor wished they had done 10, 15 years ago.
Yeah, that's a really great point. Because yeah, sometimes I think people just like take mentee or their mentors words at face value, but yeah, remembering they have their own lens, and realizing that like you need multiple mentors just because like your career will look different than theirs. But also knowing it's okay to break up with the mentor when needed. So yeah, I think that's a really great way of like and figuring out when to end things and when to continue on. So awesome. But yeah, thank you so much, Dr. Tien. It was really great having you here. Great episode. We really enjoyed this. I was really looking forward to this one. It was definitely very rewarding. Um, and to everyone out there, thank you so much for tuning in to this episode of Vitals Academia. Make sure you subscribe to our YouTube page so you can see when new episodes are coming out. And we will see you next time. Thanks so much.
Thank you.